speech disorder is a condition that affects a person's ability to make sounds that form words. This can happen due to damage to the muscles, nerves, or vocal structures. Speech is a primary way people share their thoughts, feelings, and ideas. Speaking involves the coordination of various body parts, such as the head, neck, chest, and abdomen. A speech disorder is different from a language disorder. Speech disorders impact a person's ability to create the sounds needed for communication, while language disorders affect a person's ability to learn words or understand what others say. Speech disorders make it hard for people to produce correct speech sounds, whereas language disorders hinder a person's ability to comprehend and use words. Both types of disorders can make it challenging for a person to express their thoughts and feelings to others. Speech disorders can impact people of all ages and come in various forms. Here are details on some common types. Stuttering. Stuttering interrupts the normal flow of speech, and those who experience it may have repetitions. This involves repeating sounds, syllables, or words involuntarily, such as saying basketball. Blocks. This occurs when a person knows what they want to say but struggles to produce the sounds, leading to a moment where it feels like their words are stuck. Prolongations. This means extending certain sounds or words, like drawing out the sound in sun. Stuttering can become more noticeable or severe under stress, excitement, or frustration. Certain words or sounds might trigger stuttering more intensely. Behavioral and physical symptoms that can accompany stuttering include facial and shoulder tension, rapid blinking, trembling lips, clenched fists, sudden head movements. There are two primary types of stuttering. Developmental stuttering, typically seen in young children who are still mastering speech and language skills. This type often has a genetic component, meaning it can run in families. Neurogenic stuttering results from brain damage that disrupts the coordination between different brain areas responsible for speech production. Apraxia. Apraxia involves difficulty with motor planning and coordination needed for speech. The brain sends signals to various body parts to produce speech sounds, such as moving the tongue, lips, and vocal cords, and controlling airflow through the mouth and throat. Apraxia of speech, or verbal apraxia, is a specific type where the brain has trouble coordinating the movements required to pronounce words correctly. Even though individuals with apraxia know what they want to say, they struggle with the motor movements needed to produce clear speech. This disorder affects how the brain communicates with the muscles involved in speaking. People with apraxia may have difficulty pronouncing words correctly, make inconsistent speech errors, find it challenging to sequence the sounds of speech. In general, apraxia impacts the planning and coordination required for accurate speech production, which can be frustrating and impact communication abilities. Dysarthria. Dysarthria is a speech disorder that results from damage to the brain, leading to weakness in the muscles used for speaking, including those in the face, lips, tongue, throat, or chest. This muscle weakness can make it hard to speak clearly and effectively. People with dysarthria may experience slurred speech. Words may come out in a jumbled or unclear manner. Mumbling. Speech can become difficult to understand due to unclear pronunciation. Speaking too slowly or too quickly. Speech might be unnaturally slow or rushed. Soft or quiet speech. The voice may be softer than usual, making it hard for others to hear. Difficulty moving the mouth or tongue. This can affect the ability to form words properly. Speech disorders can vary widely, but common symptoms include repeating or prolonging sounds. People might repeat sounds or stretch out syllables in words. Distorting sounds. Sounds might be altered or pronounced incorrectly. Adding sounds or syllables. Extra sounds or syllables might be inserted into words. Rearranging syllables. The order of syllables in words might be mixed up. Difficulty pronouncing words. Pronouncing words correctly can be challenging. Struggling to find the right word or sound. It might be hard to say the intended word or sound. Hoarse or raspy voice. The voice might sound rough or strained. Speaking very softly. Speech might be too quiet to hear clearly. These symptoms can differ depending on the type and severity of the speech disorder. It's possible for someone to have multiple speech disorders simultaneously, each with its own set of symptoms. Identifying and understanding these symptoms is crucial for seeking appropriate diagnosis and treatment. Speech disorders can arise from a variety of causes, including brain damage from strokes or head injuries, muscle weakness, and damage to the vocal cords. Conditions such as degenerative diseases like Huntington's disease, Parkinson's disease, or amyotrophic lateral sclerosis, ALS, as well as dementia, can impair speech. Additionally, cancer affecting the mouth or throat, autism, Down syndrome, and hearing loss can also contribute to speech difficulties. Certain risk factors increase the likelihood of developing a speech disorder. These include being male, being born prematurely or with a low birth weight, having a family history of speech disorders, and experiencing problems with the ears, nose, or throat. To diagnose a speech disorder, a speech-language pathologist, SLP, performs a detailed evaluation. This involves reviewing the person's medical and family history and examining their ability to move their lips, jaw, and tongue. The SLP may also inspect the muscles of the mouth and throat to assess function. Several specific tests are used to diagnose speech disorders. For example, the Denver Articulation Screening Examination evaluates the clarity of pronunciation. The Prosody Voice Screening Profile assesses various aspects of speech, including pitch, phrasing, and speaking volume. The Dynamic Evaluation of Motor Speech Skills, DMSS, provides a comprehensive guide to help SLPs diagnose motor speech disorders. These assessments help the SLP determine the presence and type of speech disorder while ruling out other conditions that might cause similar symptoms. The treatment for speech disorders varies based on their severity and underlying cause. Several approaches can help manage and improve speech disorders, including speech therapy exercises. These focus on practicing specific words or sounds to build familiarity with challenging speech patterns. Therapy may target difficult words or sounds that frequently cause disruptions in speech. Physical exercises. These exercises aim to strengthen the muscles involved in producing speech sounds. Strengthening these muscles can help improve the clarity and fluency of speech. Target selection. This technique involves practicing specific sounds or words to become more comfortable with them. For instance, therapy might focus on sounds or words that are particularly challenging for the individual. Contextual utilization. In this approach, speech-language pathologists, SLPs, teach individuals to recognize and use speech sounds in different syllable contexts. This helps integrate sounds into natural speech patterns. Contrast therapy. This method involves practicing pairs of words that differ by one or more speech sounds. For example, saying beat and feet or dough and show helps individuals learn to produce distinct sounds. Oral motor therapy. This approach improves muscle strength, motor control, and breath control necessary for speech. Exercises in this therapy aim to enhance fluency and make speech sound smoother and more natural. Ear devices. Small electronic aids worn in the ear canal can help people with stuttering. Some devices replay altered versions of the wearer's voice to create the sensation of someone else speaking with them, while others produce a noise that helps manage stuttering. Medication. In cases where speech disorders are linked to anxiety, medication may be used to reduce anxiety symptoms. This can, in turn, lessen the impact of the speech disorder. In conclusion, speech disorders can significantly impact a person's ability to communicate, affecting their self-esteem and daily interactions. Understanding the types of speech disorders, their causes, and the various treatment options available is crucial for managing and improving speech. Whether through targeted speech therapy, physical exercises, or the use of specialized devices and medications, effective treatment can greatly enhance a person's ability to communicate clearly and confidently. Addressing these disorders with appropriate care and professional support can lead to meaningful improvements in quality of life and personal expression. Moreover, early intervention and consistent treatment are key to achieving the best outcomes. By working closely with speech-language pathologists and staying committed to therapy, individuals can overcome many of the challenges associated with speech disorders. Support from family, friends, and professionals can also play a vital role in encouraging progress and boosting confidence. With the right resources and determination, individuals facing speech disorders can find new ways to express themselves and engage fully in their personal and professional lives.